Hello, everyone. My name is Carol Trone, and I am with the Wisconsin Coalition on Student Debt or Debt Smarts. Today's webinar is on budgeting for medical school. With us today, we have Kristin Mootz. She is the Director of Student Financial Services at the Medical College of Wisconsin. Kristin brings to this presentation over 22 years of professional work in student financial aid and financial services. And she's a very active member of the Wisconsin Association of Student Financial Aid Administrators, WASFA. So thank you for joining us today, Kristin, and I'll turn it over to you.
Great. Thank you so much, Carol, for this opportunity to give an overview of medical school costs and funding. I know there's a lot of work that goes into even getting to the application point for medical school, so thinking about how you're going to fund your education is another important part of the process. So today we'll cover a wide range of topics covering tuition and fees, other costs associated with attending medical school, options you may want to consider using to pay for school, and then we'll wrap up with some budgeting tips and takeaways along with time to answer some questions. So the first item we'll cover today is tuition and fees. These are considered direct costs. They are charged by and paid to the university or college directly. These are items you'll see on your bill or student account. I'm going to share some data provided by the AAMC, which is the Association of American Medical Colleges. They have lots of information resources, and I would encourage you to review the information they have. So direct costs include tuition that is typically billed by semester, but this may vary by school. Fees are typically mandatory and are charged by the school as well. Common fees are technology, equipment, student services, student activity lab, background, and more. Both tuition and fees can vary greatly by school and sector, meaning state schools tend to have a lower tuition, especially if you're attending the state where you have established residency, whereas private schools tend to have a little higher tuition. I am sharing on this slide the AAMC's average of direct costs, just to give you an idea of the average tuition and fees. You'll see health insurance added. Most medical schools offer health insurance options for students who do not otherwise have coverage. Clinical sites do require proof of health insurance for students to be able to participate at their locations. I will say health insurance is one of those areas where you could save on the cost of medical school if students are under age 26 and they're able to stay on their parents' insurance, or if they're married, perhaps a spouse's insurance is a more cost-effective choice. Schools will be providing you with this information prior to matriculating or starting school. Next, we'll look at some indirect costs. As you likely know from undergrad, there are more costs students incur other than just the bill from the school. You have costs associated with books, supplies, as well as living expenses for rent, food, gas, utilities, and other things. Often you'll find grad school housing would be on your own and not on a campus dorm like you had experienced in undergrad. The AAMC also lists an average for the allocation schools allow for living expenses. I've shared that information on this slide. So you can see once you add in the cost of living with tuition, the total for the first year can easily exceed $100,000. This is likely the largest expense students have faced in their lives to this point, so it's important to have a plan to pay for medical school before you get there. The amount of federal aid and scholarships are far less than you'll have seen in undergrad school, so we'll go over that in a little bit. And then while these numbers can be overwhelming, this doesn't mean this is exactly what you'll pay, so we'll talk about what to look for next. The big question you'll want to answer is how much will I have to pay? So for direct costs, you'll be able to see these on your bill as an itemized statement. It's relatively easy to assess these costs and look at it from school to school. Other costs are less straightforward. You can start by using the cost of attendance schools provide. They include rent, food, and other living expenses that you saw on the previous slide. Each school does develop a cost of attendance based on federal requirements to provide a moderate living allocation for students. These costs are only for students to attend school. They're not really meant to support pets or family members. Students are responsible to live within their means, and planning is especially important if you're going to be using financial aid for all of your living support. The sticker price you see for the total cost of attendance may not be the full cost for your personal expenses. They may be more or less depending on a number of factors. So you need to look at if you'll receive a scholarship or institutional aid offers, if parents will provide the health insurance or auto insurance, if you have a roommate, or maybe you have other debt you're bringing to school with you. I just encourage you to compare both direct and indirect costs, along with aid offers, the academic setting, curriculum outcomes, and learning preferences as you evaluate your different schools. Now, there are other costs that are not represented in the numbers you've seen so far that you'll want to plan for. These include the costs of moving to school. This is generally a cost the student will pay themselves before school even starts. In future years, you will be required to take exams to progress through your program. These exams do have extensive test prep. Materials can be accessible through your school if they're included in fees. Sometimes you may need to purchase the resources on your own. And some students find they need extra support for exams, which may require additional investment in your testing preparation. Part of medical school does involve um, attending rotations in healthcare facilities. The rotations may be mandatory or elective, and these can also add to your costs in later years. And then in your final year, interviewing for residency is crucial. There are costs associated with applications, travel, apparel, and maybe some technology for virtual interviews. And then finally, once you do graduate and attain that residency, you'll likely need to move again. So these are just a few examples of costs that you want to be prepared for as you attend medical school. And then if you are fortunate to receive multiple offers to schools, you'll want to carefully review all of the information before deciding where to attend. So you can look at all of the costs, both direct and indirect. And then, for example, if you're able to attend a school where you can live with a family member, you may be able to save on living expenses, which could lead to an overall lower cost, even if that school has higher tuition. I would also recommend developing a budget for each school. Research the rent, grocery access, transportation costs, and compare the cost of living in each area before you commit. It's also important to look at the resources you have available against these costs. See what you have available to you and what gaps you may have. This may help you not only decide between schools, but also how much of a gap you'll need to fill with other resources. And then as you evaluate the cost of medical school and the gaps you may be facing in funding, it's important to understand all of your options. So we're going to go ahead and explore a few of those next. And then, as I mentioned, aid at the graduate level is limited, even more so now with the changes Congress passed last summer. So this information is accurate as of March 2026. There is one federal aid program available, the Direct Unsubsidized Loan Program. It is a loan, it does need to be repaid. And if you had loans for undergrad, you likely had a subsidized or unsubsidized direct loan, or possibly both. This is a very similar program. However, aid at the graduate level is not need-based, meaning everyone who is eligible qualifies for the same amount. For the Doctor of Medicine degree, the maximum you can borrow is $50,000 a year. There is a lifetime maximum of $200,000. So it is extremely important to finish your degree in 4 years. This limit of the $200,000 does include graduate borrowing for other degrees if you had borrowed for that. Terms are set by the Department of Education each year. The current interest rate is 7.94%. It is fixed for the life of the loan, but each year they set a new rate, so your loans for each year will have a different rate. The Department of Ed also charges an origination fee of just over 1%. So say you borrow $10,000, they'll keep about $100 before dispersing the funds, and then you would receive about $9,900 to pay for school. To apply for the federal direct loan funds, you must file the FAFSA, complete a master promissory note, complete entrance counseling, and all this can be found on state.gov. And then if you recall prior slides showing the costs, you can see that federal aid does not cover the full costs. And in many cases, it does not even cover the tuition. So you want to explore other options if you do not have personal resources to make up the difference. Some of the most generous programs are scholarships with a service commitment. These programs often provide tuition costs as well as a stipend for living expenses. The general rule we see for this is a 2-for-1. It means for every year of funding, you're required to provide 2 years of service to that organization. You'd want to check with each program for application and eligibility requirements. And the most common programs we see are listed here, from the National Health Service Corps through HRSA. Each branch of the armed forces does offer a similar version called a Health Profession Scholarship Program, and there is an Indian Health Services program as well. These programs are very limited and very competitive, so I'd recommend applying for them early. Another resource is to check for your state or local medical facilities for more scholarship opportunities. Another source is to check with the school to which you're applying for any institutional aid they may offer. It is often made up of scholarships or loans. Institutional aid varies greatly by institution, so it's best to check with each admissions or financial aid office. There are different types of awards schools may offer, such as merit awards or financial need-based awards. So you want to check directly with the school for their offerings and if there is an application process for these funds. One other option to consider is private education loans. These do require school certification and are limited to the cost of attendance. You are free to use any lender of your choice. You'll want to make sure it's an education loan because a personal loan will have payments due right away, whereas an education loan typically has in-school deferment, so you may not have to start making payments right away. Private loans can be used to fill in the gaps up to the cost of attendance and may be an option to explore if you need funds for living expenses. Eligibility for private loans is generally credit-based. They often require a cosigner, as students typically do not have long-time established credit history at this point. And even if a cosigner isn't required, you may want to consider having one to get a better rate. Be sure to compare different terms from a variety of lenders. Be mindful of loan limits and residency deferment options, as this is an area where many lenders differ. And then finally, there's another private loan option that can help fill in some gaps, especially near the end of your program. There are options for residency and relocation loan that does not require school certification. So for this one, you generally have to be within 12 months of graduation to be eligible. It does have a cap, so usually it's for $3,000 or less, and it is meant to help with expenses. So it's associated with finding a residency, including applications, interview, travel, and relocation after graduation. So depending on your situation, you may want to explore a combination of the options we just reviewed to help you pay for medical school. And then as you plan out your medical education and review the resources we just covered, it's important to create a budget to ensure your resources will last during your entire enrollment. So let's take a minute to talk about some tips to keep in mind. So if you're going to use financial aid to pay for school, budgeting is really key. Aid is typically dispersed at the start of each semester, and you tend to receive two large lump sums. So while it may be tempting to loosen your budget plan when you have all that money at your fingertips, keep in mind these funds need to last for until your next disbursement. And then while rent is generally due at the first of the month, depending on when your classes start, you may have a delay between semesters and disbursements. So you want to check the disbursement dates with your school and make sure you plan accordingly. There are many helpful online tools or apps that are excellent for budgeting. I would recommend exploring a variety of options and choose one that works best for your style of learning and your spending. You will want to also continue to live like a student in graduate school. Buying a new car or home may need to wait if your resources are limited. You can use your school's cost of attendance as a guide to find an apartment that won't put a strain on your finances. And then, if at all possible, I know it's difficult, but try to save for the unexpected. A car can need repairs, a cell phone can get damaged, or an unexpected medical bill. If you're able to build up even a little cushion for emergencies, it'll help put your financial situation in a better position. Now, there are several methods students use to help conserve their funds and ensure they spend them in areas for which they're intended. So here's just a few suggestions to consider. One is developing a budget for each semester. For this method, you would map out your expenses for rent, food, transportation, utilities. Make sure you include all of your costs, and then divide your resources over both semesters to ensure you have enough funds to last you the full semester and through any scheduled breaks. Another option is to pay yourself a paycheck. So this helps avoid the temptation of spending that lump sum you receive at the start of the semester. You'd put those funds into a separate account and then transfer money or pay yourself on a monthly basis. This way you help conserve your funds and spend them consistently and ensure you don't overspend on items outside of your budget. And then finally, there's an envelope method. This is used less now that we're in a cashless society, but the concept is essentially the same. You assign every expense to an envelope. So rent, groceries, utilities, entertainment, pretty much every category you would spend on. And then when that envelope is empty, your spending in that area stops. So with online banking, this could translate into setting up a budget on your account to help you track spending categories. It is important to constantly watch your spending so you catch any trends and make sure you're saving enough funds for rent and food later in the semester. And then as long as you have a way to monitor your spending, you should be able to stay within your budget. Now, I know we've covered a lot of information, and that's a lot to process from what we shared so far. And you're likely realizing, if you didn't already know, that medical school is very expensive. It is probably the most expensive investment you or your family has made so far. It is an investment in yourself and your future. It can be very daunting. And while it is expensive, there are ways you'll be able to pay off your debt and enjoy a lucrative career as a physician. So for loan repayment, there are a couple of tools to consider. Federal loans do have several benefits, which include the option to defer your loan during residency. This allows you to postpone your payments when you enter residency and your income is lower. There are income-driven repayment plans that will base your payment off a percentage of your discretionary income rather than your loan balance. This is helpful to have a lower payment when your income is lower and ensure you have a payment you can afford. And then public service loan forgiveness is available for employees working for government organizations, nonprofits, or 501c3s. And after 120 months of payments, or 10 years, the balance of the federal loans is forgiven. This forgiveness is not a taxable event. Many students start their 120 payments while in residency versus choosing deferment to get started on the positive progress towards forgiveness right away. Many employers and even states offer loan repayment assistance where they'll help employees pay off their student loans. This is a taxable benefit, but some programs are very generous and help reduce the debt burden. You'd want to check with employers while interviewing or after residency to understand what options are available to you. And then one key factor to keeping your loans down is to keep your costs down. Work with a financial aid office to understand available resources and options to you. Borrow only what you need. Make sure you live within your means. And then really consider those service-based options I mentioned earlier. They were far less popular in the past because students didn't want to commit to service commitment. However, these are some of the most generous programs available to help fund medical school. All right, well, that was a lot of information we covered in a short time. You can find more resources for medical schools using the AAMC's website. They have articles, videos, different tools to help you through any phase of your medical school education. And I would recommend starting there if you're considering medical school. This slide is the contact information for the coalition, which has a wealth of free resources to help you through your journey. And then, Carol, I believe we have some time for questions if you have any.
Thank you, Kristen. That was super helpful and very thorough. And I want to let our listeners know. So you may be watching this on our Facebook Live, which is great. But other places that you can continue to access this, the recording of this presentation, will be through our website, which is debtsmarts.org. There's a page on there for webinars. And then we also have a YouTube channel. So if you go to YouTube, our channel is Debt Smarts. You will find this recording right there. So let's jump into some of the questions that we received in advance of this session. So let me get the first one here. All right. Are there good websites or places to look for scholarships?
Yeah, great question. Very common question, also, as you can imagine. The best place to start looking for things related to medical school is the AAMC.org. So it's aamc.org. They are the trusted source for all types of information, including funding options. As I mentioned, the most generous but service-based scholarships, you'd want to check out the NHSC for the HRSA program. And then you could look at each military branch site as well for their health profession scholarship program. As always, talking with your financial aid office is another resource. I did mention, there aren't a lot of options at the graduate level like there are at the undergrad, but you certainly can use the search engines through FinAid, College Board. I would just make sure that you don't pay to apply for scholarships. They should always be free. And then one other place is to check within your local community. There are local organizations, churches, or clubs maybe you belong to that often have other leads that you may not even know existed.
Great, thank you. And we will put together some of these great resources in sort of a notes file that we'll share as part of the webinar recording here. So another question is it common or advisable to have some kind of job, part-time job during medical school to help with those costs?
Yeah, another great question. I would say attending graduate school, especially for a medical degree, is a full-time job in and of itself. So for our program, we do not recommend students work and also try to attend school. They are already studying for well over 40 hours a week, and adding another time commitment to the schedule is very difficult. It easily leads to burnout. Um, this is also why we stress the understanding of making sure that you understand the full cost of attending school before you get there, right? You need a plan to fund for your living expenses, not just tuition while you're attending medical schools. Going part-time to, supplement for a job, it's often not an option with medical school curriculum. You'd also be extending that graduation beyond the 4 years, which would mean you'd eventually run out of federal aid and hit those caps.
Good. Okay. So it sounds like think about medical school as your job. It is your full-time job.
Exactly.
Okay. What are some common mistakes that you see that medical students make when they're trying to cover all these costs?
Yeah, I don't know that they're necessarily mistakes. I think we all in general underestimate the power of today's marketing and impulse buying. We're surrounded by it. You go to the web, order what you need whenever you think you need it. It really takes skill and restraint to stick to a budget for the full semester. It can be very tempting when you get your lump sum of ten to $15,000 for the semester to think, oh yeah, I have enough money to last me through the next 6 months. So before you even start medical school, I would say make sure you find a place to rent that is within the rent allocation. Choosing a place with higher rent does not mean you're going to get more funds for rent. One other thing is now is probably not the best time to buy a new car if you have one that's working just fine. Getting a new pet can also be another expense where, one vet visit can put a huge strain on your already limited budget. So I think the key is really just coming up with a budget and sticking to that is the best thing to follow, especially when you're on a limited income.
Great. And then I know you covered this next question in some of the slides here, but could you just remind us, are there opportunities? So chances are you're going to be taking out loans to pay for medical school. So are there opportunities to have the loans somehow covered, forgiven, assistance with payment?
Yeah, another great question. I think this is an area that's constantly evolving, especially in recent years as communities face healthcare provider shortages. For the federal aid and direct loan program, many students look into public service loan forgiveness or PSLF. 99% of hospitals are nonprofit, so there's a good chance future doctors will end up at a qualifying employer. And then after making 120 required payments, essentially 10 years, any remaining balance on your eligible direct loans is forgiven. There are other programs that can help offset student debt as well. Many employers do offer loan repayment assistance to help employees pay off their student loan debt. Some states offer loan repayment assistance as well. So, for example, Wisconsin has a health service scholarship program to encourage professionals to practice in health shortage areas. This is for primary care physicians, psychiatrists that are Wisconsin residents and will practice in a shortage area. They could receive up to $30,000 a year. So, it's really difficult to say today what this landscape is going to look like in 7 to 10 years when the current applicants are entering the workforce. But I think given the expected shortages, we'll likely continue to see back end benefits offered by employers and even stays to help attract and retain talent.
Great. Well, thank you, Kristen. This has been just an amazing amount of information to process and to help us lay out what that landscape looks like. It reminds me that you work as a financial services specialist, and it sounds like really for students with questions, going to their financial aid office is a great place to get accurate answers.
Yep, always the best place to start, and we're usually happy to help with that.
Great. Thank you so much, Kristen. I am going to stop the webinar here. And for folks who are interested in these kinds of topics, just a final reminder and plug. So our organization, Wisconsin Coalition on Student Debt, Debt Smarts, you can subscribe to our newsletter. We're very active on Instagram, Facebook, and yes, even TikTok. And so through all those places, you can find, as well as our website, of course, you can find notices of upcoming webinars. And we cover a wide variety of topics related to minimizing student loan debt and then being able to manage any debt that you take on. Thanks, everyone.
Thank you.